Welcome to State of Reform's virtual leadership series with some of healthcare's most thoughtful leaders. And now, the host of State of Reform, DJ Wilson.
Hello and good morning. Welcome back to day 2 of our 2021 Washington State of Reform Health Policy Conference. I appreciate you making it back and getting up with us here, of course, early Pacific time, but it's not early in Rome or London or Mogadishu, and those are all places that we're going to be going here for our keynote conversation here in just a second. Just want to remind folks about the flow of our day as you're checking in. Make sure, of course, to visit our networking page. You can send private messages. You can send video messages there to other attendees at the conference. Of course, we have a number of networking sessions teed up for you, and those were actually really well received yesterday. I do need to note this one administrative matter that senior reporter here at State of Reform, Emily Berger, and her team of folks that included, I think, Matt Miller and Caitlin Safford, won the first ever State of Reform trivia last night, and so kudos and bragging rights to those guys. So let's jump right in. As we know, particularly if you were with us during our Inland Northwest event, there are a number of things that COVID allows us to do if we just think a little differently. And certainly in the before times, we would not have been able to speak with these 3 guests, or any guests, frankly. We would not have flown in people from Rome, Italy, and Mogadishu to join us here at this conference. And so it's a unique characteristic of the COVID economy, of this COVID era, that we can host this virtual conversation with 3 of the smartest, most genuine and gracious people I've ever met in my life, I'm happy to say. And that is Ross CIESLA, Chief Investment Officer at Veritas Investment Partners, now Foreign Minister of Somalia, MOHAMED ABDIRIZAK, and KATHERINE Wilson, no relation, but a great last name nonetheless, author and cultural commentator based in Rome. Thank you guys for making time to be with us. Let me start with you, Ross. Britain, and you're in London. Britain's sort of the site right now of, one of the biggest waves in the world. Give us just a little sense as an individual, as a person, as a father and a son and a brother, what it's like living in Britain as you guys have this new variant rolling out, and the national health system really is starting to buckle. Give us a sense of what's going on there on the ground.
Bad. It's so we've now gone into a hard lockdown again. I think the number of critically ill patients now has gone from, I think the peak in April was about 21,000. And now we've just broke through 30. So we're up 50%. And the news flow is changing from the government, from the BBC. We're seeing a lot more reports from consultants, nurses, and I think this has been delivered for a reason, because they're wanting people to know this is extremely serious. One report last night from one of the hospitals based in London, which is really, really feeling, I think, the worst. One of the consultants, I think it was, said that we're weeks away, I think within a week, from full capacity. And he went on to explain that if this keeps going, then we will be so overloaded that even if you have a car accident, it might be difficult to bring you in for critical care. So the second wave is extremely serious. So we are in hard lockdown, and it's a race. We're now in this race to get the vaccine through the population as soon as possible because of the second strain.
So Ross, just to stick with you for one second, how is the government mobilizing for this? What are you being, as a citizen, being called to do? How are you all getting organized to deal with this?
So the initial plan so I'm just thinking if it's schools of it might be of interest, that was that all schools in the first 2 weeks in England and Wales, what was happening, teams were being brought in, parents were being brought in, and halls were going to be converted. to basically COVID testing labs for all the school. The idea was in the first 2 weeks, every pupil was going to get, I think there's a lot more experts on here than me when it comes to healthcare. I think it was a lateral flow device test, and you get the results in half an hour. And the idea was all pupils in secondary school were going to be tested twice within the space of 2 weeks, 3 to 5 days apart with each test. And the idea was that's been a huge area of spread. We need the data from the pupils. And what's been happening is if someone in your year or bubble is infected, then your whole class would be sent home. Everybody is out. And what's happening now is they wanted to test everyone, check who's negative, check who's positive. And if you're in the class with someone who's being sent home, as long as you agree to test every single day for 7 days or 5 school days, and if you're negative, you can stay in school. And it was like a huge mobilization here for war against COVID, because we can see what's happening with this second strain. The issue now is everybody's been sent home. Now, I can tell you the infrastructure is still set up in schools because I've been trained on it and I've been in. So I don't know what the next part is going to be. Are they going to start bringing some pupils in? But it's been a mass mobilization at the secondary school level.
You've been trained. I mean, you're a financial investment chief investment officer. You're not a nurse or a physician assistant, right?
Yep.
Yeah. So, Catherine, how about you? Give us a rundown of how things are going in Italy.
Well, in Italy, there was a lot of talk before Christmas because as a very family-oriented country, the big question was, can we hug our grandparents and can we eat what the nonna cooks for Christmas Eve dinner? I mean, that was the sort of cultural question. And what the government did is the government was very clear about not having more than 6 people at Christmas and not moving between regions. So the whole country went into what they call a red zone, which is sort of a lockdown over the holidays. Our numbers have been not as bad as they were anticipating, in part because there's been a ton of testing. Testing is very easy and everywhere. And also because the media has been all over the place saying, we need to protect the older generation. We need to protect the weakest members of society. Now, as we were talking about before, COVID is no longer in our minds the disease of the elderly or the infirm. It's now everyone's disease. But I think that one of the things that was destructive in the beginning was this idea of, well, it's not gonna hurt kids and it's not gonna hurt teenagers. So let's do a little bit of compartmentalization of society. Well, one thing that sort of, I guess, in a way helped Italy is that in Italy, it's impossible to compartmentalize because it's such an intergenerational society. And so many young people in Italy, I mean, the average age of moving out is something like 30, which for an American is unheard of. And even when, a kid moves out at the age of 30, still their parents are living down the street. So it was always kind of impossible, this idea in Italy of the elderly and then the young people. And I have to say that as an American, I found it very touching how there's no sort of antagonism between the generations. I mean, the elderly, I've heard so many older people saying, these poor kids, we had our youth and we were able to go out and see each other. Let's do everything we can so that they can see each other. There's not been as much of an idea of those irresponsible youth who are trying to do this, that, and the other, and then we're the ones that bear the brunt. So culture, that's what's going on. I, as a parent, I have 2 teenagers, and in theory, next week they're going back to school, but in 50%. So they go back 2 days a week. They've divided up the classes so that they're not, the density isn't too high, and they do testing at school every 10 days. So that's kind of where it's at here.
Yeah. Mohamed, again, since we saw you last in Kenya. Now you're in Somalia as foreign minister. Congratulations very much on your appointment, sir. Tell us how it's going. I know that the rates of infection have not spread nearly as rapidly in Africa. give us a rundown of how you think COVID is impacting Somalia and Africa in general.
Thank you, DJ, and fellow panelists, distinguished guests, ladies and gentlemen. I am very happy to join you here today and to be addressing this forum. DJ, unlike last time I joined you, these days I read a lot of statements, so if you would allow me, I will read a quick one that covers all the questions that you just mentioned. The COVID-19 virus has challenged the world politically, socially, and economically. Devastating lesson and loudest possible wake-up call in the need for full cooperation, effective partnership, and firm commitment to multilateralism to confront it together. As I mentioned in the last forum, the virus recognizes no borders, nationalities, gender, individuals, or economic status. We're all equally victims of this deadly disease. In Somalia, initially, there were a number of deaths right at the beginning, and the precautions were not the same as the country. When I spoke to you last time, I was in Kenya, and it was not the same how Kenya practiced and put measures in place. Somalia has not done that to my extent. And so initially we had a peak, but just to go back to this and give you some figures, based on the latest COVID situation report that is jointly published by the Somalia Ministry of Health and Human Services of the federal government of Somalia and the World Health Organization country office, between the 20th and 26th of December 2020, reported a total of 4,015 suspected cases of COVID-19. These were the people who were tested, of which 24 were confirmed to be positive. The positivity rate for that reporting week stands at 0.6%. And it has been below 2% for the past 8 consecutive weeks. Since the 16th of March, 2020, when the first case of COVID-19 was reported in Somalia, 4,714 laboratory confirmed cases of COVID-19, and a total of 130 people lost their lives as a result. Many more had to live with the pain and suffering of COVID-19, while others remain very vulnerable given the weakness of Somalia's overstretched health system and infrastructure. The cumulative positive rate since the start of the outbreak has declined gradually, and as of this week, the rate stands at 6.1%, whilst the cumulative case fatality rate stands at 2.7%. So let me stop there for that part for the moment. That is just a snap picture of where things are now, and also since the beginning of this pandemic, which in Somalia was around March 2020.
Yeah. I want to bring up this this graphic from The Economist, the Economist Intelligence Unit, that talks about or demonstrates when they believe that countries around the world will receive vaccinations. This tells me two things as we bring this up. One is, and I'm interested in your thoughts, Mohamed, sort of speaks to me about like how long this is going to take to get people vaccinated everywhere in the world. It's going to take a long time. And just the reality, or at least the course that the world is on, that is inherently unequal rather. What are your thoughts about global health equity and when Africa should be getting vaccines? Do you think that because of the lower rate of death and infection that this actually makes some sense? Or do you think that the World Health Organization and pharmaceutical companies need to think differently about distribution?
That's a very important question, DJ. And right at the outset, I would say, I mean, just as I just mentioned, this pandemic knows no boundaries, individuals, economic status, and it will, if you're not careful, you will contract it, and it can be deadly. We've seen that. So it is very important to have an equitable distribution of the vaccines between, countries that have that can afford it, that have a better health system, and those that cannot. I think one thing we've learned from the lockdown, especially in Somalia, one of the things that have helped, despite the way people have behaved, was there were no international flights coming into Somalia. But once that opens up, Somalis travel a lot, but we also have a United Nations base here. We have African Union mission with a number of countries participating, over 26,000 African Union troops. So there is going to be a lot of movement. And as people move around, the rate of infection can go back up again. We all know that there's this second wave going on, and there are different strains, and I'm afraid that will also come to Somalia. So we have to continue to be vigilant, but also try to see if we can all get the vaccines. By the way, I am traveling tomorrow all the way to the US, to Washington, DC. Today I took my COVID test. I'm negative, thankfully. And so that is the kinds of, I will pass through at least one country before I come to the US. I will self-quarantine for a few days and take another test before I come out for meetings and whatnot. And I think that is the right approach to this.
Speaking of your trip to DC here, Mohamed, I'm still trying to figure out how to deal with the events in the United States yesterday with protesters becoming insurrectionists and entering the Capitol in Washington, DC. I'm wondering about each of you, starting with you, Mohamed. How do you view the events in Washington, DC yesterday, both the American Republican democracy working and the Electoral College count being affirmed, and the seditious action of folks entering the Capitol and vandalizing and trying to put that democracy to a halt? What do you think?
First of all, as I just said, this is not going to change my mind about the trip to Washington, D.C. and to New York later on. For the simple fact, I mean, this is shocking. This is really, people even here in Mogadishu are all glued to the TV watching this. But American institutions, public institutions, governance institutions are very strong to withstand this. So I'm not worried about this in the long term. But it also shows that in the short term, there needs to be real conversation needs to be had about who we are as a society. And I say we because I'm also an American citizen, even though I'm foreign minister in Somalia. About our values, about so many things. These conversations at times will be getting out of control, and I think that's the best way I can put it. But it says that the conversation really needs to be had. But I'm very confident that this will be a period that we will all pass.
Catherine, I'm interested in your thoughts on yesterday's events as well, but I'm also wondering how you explain them to folks in Italy.
Yes, it's not easy. I noticed that Italians, maybe like a lot of people all around the world, look to the US often as an example and as a model. And I've lived here for over 20 years. And often Italians will say, when they get to the point of political corruption and being disenchanted with the political system, they look at me and they say, well, in the United States, something like this could never happen. And I smugly say, well, yes, you're right. But I realize now, after yesterday, after these past years, that, you know, we're not immune. We've been talking so much about immunity and who's immune to COVID and who's not immune. And it's like this common humanity that has been one of the only positive thing that's come out of COVID, which is we really are all the same. And in the same way, this thing that has happened in the US is actually not all that unusual globally. I mean, it's not something that doesn't happen. It's something that happens, and we're not immune to it. But that said, I agree with Mohamed that our institutions and our sense of optimism and hope and real faith in democracy will mean that we'll get through it.
Ross, what do you think? How was the virtual water cooler yesterday? I mean, Boris Johnson is sort of like Trump. He's not quite the same. I don't know that Boris Johnson would ever incite violence the way that President Trump has. How are you and people in your community reacting to the news, and how do you make sense of it?
The first reaction was disbelief, but then the second reaction was, actually, maybe this isn't a surprise. Because, I mean, I love the States. Huge fan of the States. My wife's American. She's from Detroit. You know, one of my favorite countries is the United States. I love the optimism, the can-do, the friendliness, the warmth of the country. I'll share an anecdote with you. I remember being in the States about 3 years ago. It was April time. And I just switched on one of the news channels. And it was what I would class as a neutral news channel. And there was 6 or 7 headlines. Every single one of them was negative. Every single one. It was scare you negative. There was nothing positive. And yet there's so many positive things happening in the States. And I thought about that last night. I just thought, wow, the incremental fear within the media, maybe to get ratings. Is that what it is? Don't know. Not expert enough to know. But that incremental, negative, divisive, antagonistic news flow, it fires up the fringes. And I kind of thought of that last night, how that media resulted in such division. And then it's in complete juxtaposition to what's happened with the vaccine. We were told it would take 10 years, but everyone's worked together. Now we've got several vaccines and we've worked together on a common cause, and we're getting ahead of it in no small part because of the fantastic healthcare industry in the States. So it's sad, but I truly hope we're closing the door on this now, because the world needs the US.
I wonder, Ross and Catherine both, because you're in countries with a national healthcare system, universal healthcare system. Jim Bloss, one of our attendees, asks about how well, and he says he's asking as a fan of universal health systems and would like, as an advocate of that here in the United States. But he asks, should that system have responded better, given universal coverage to this pandemic, either in the front end in the early days, or now that we've been in this, 9-10 months, now that we've got this second wave coming. Catherine, do you have any thoughts first on that question?
Well, I think it's ironic that in Italy, which was one of the first countries hit so terribly, one of the things, and this was one of the saddest, most ironic things, was that because healthcare was so good, the hotspots became in the hospitals. So what happened in the north, what happened in Milan and Bergamo and the smaller places in the north, is that people were taken to the hospital immediately, and they got what was at the time fantastic care. But what happened was, unfortunately, nobody understood what this virus was. And so they didn't understand how contagious it was. They didn't understand that going on a ventilator and getting tubed up immediately could cause other things. So what happened was at the hospitals, it would have actually been, people would have ironically been better off if they had stayed home a little bit more at the very beginning, because it was the hospitals that then caused the explosion. But I think that's a real exception in the sense that now that we understand more about the virus, we don't understand everything. And as we saw, as Ross says, I mean, with this new strand, we don't even know. I mean, it's just a continual lesson of humility for everyone, saying everything we knew, we can take this much of and move forward. But I think that at this point, the universal health care is so essential, and the democracy of the care that is happening here in Italy is absolutely essential. And as I was saying before, for me, it's been touching in Italy, the sense of protection of the most vulnerable of society. But what has also been touching is the sense of protection of the healthcare system. Everybody's talking about how can we protect this thing that we all complain about all the time until there's a pandemic and we realize just how important it is.
Ross, how about the NHS in Britain?
I think it's definitely been an asset. However, I don't think we've coped as well as people would have hoped. If you wind the clock back, and I think this is down to messaging on the political side, the UK had this dalliance with herd immunity. And I think that people lost trust in the messaging that was within that. What is the tactic here? And then the NHS has been left to pick up the pieces in many ways. But as to whether it's been a positive or negative, I certainly wouldn't change it.
So as we near towards the end of our time together, I guess, I mean, I have a lot of questions I'd love to ask. I mean, Mohamed, let me just ask you this one. I don't know, before I was going to get to our last question that I wanted to pose to each of you, but Mohamed, let me go out on a limb here and ask this question that I've just learned about. And so this may not be something that is common, but apparently there is a new South African mutation that is more concerning, and that it is more concerning than the British mutation that Britain's struggling through. How will we know when this catches fire in Somalia and Africa, if it ever does? And how does the world sort of come to the aid of Somalia if this does catch fire like it did in Milan and London and Los Angeles? What do you think?
Are you talking about this song called Jerusalem?
No, no, but
I mean, this was an issue in Kenya, and I have to explain to the audience that I've lived in Kenya for quite some time and worked there, and which is right next to Somalia, but I'm from Somalia originally, and I'm here now in Somalia. But when I was in Kenya, the health ministry was talking a lot about social gatherings because after the first shock and the fear kind of wore off, people went back to, and government started to allow a little bit more of, the bars and, restaurants and things open. Once people went back, they pushed for, what people do socially, music and all of that. And that was problematic. In Somalia, what we have is we're crazy about soccer. And our stadium just 2 weeks ago, despite the ministry and all the government officials talking about this, you could not stop people. And I will send those pictures to you later. You would be shocked that people can gather like that. So there is, what that says is there's a huge need for continuous public information and education about the pandemic. Sharing this, the statistics. This is a new virus that we know very little about. It is only about a year old. We don't know what is the future, even those who contracted already and recovered. So people really need to be careful about this thing. And so that is required.
Let me ask you all, are you all in your families, is everyone healthy, I hope? So far, so good? Good.
Yeah.
Physically healthy, but a whole lot of COVID fatigue, which I'm sure is common around the globe.
Yeah, the mental health, the anxiety is, it's a burden that we're all going to bear coming out of this. Ross, as we wind up, let me just ask each of you, I'll start with you first though. What advice, what counsel would you give to our audience? You know, like I said, we've got almost 700 folks at this conference, and a lot of folks will be watching this afterwards on demand. And this was one of our most popular panels that we did this year when we did this with you three earlier in the fall. So as we wrap up, what counsel would you give folks as they try to navigate 2021, as they try to manage mental health, as they try to reconnect with families? What would you tell Americans watching this?
Actually, I suppose navigating 2021 is all about the next 3 months, because it dictates what happens for the rest of the year. And I can't help but think people have got to pull together and get ready for the second wave. If you want more details on it, go and have a look at the reports that come out yesterday on the BBC website, which I'm sure you can watch in the States. This is material. And I really hope the US pulls together on this and tackles it, because my understanding, of course, with vaccines, you've got to get ahead of get the vaccine in before it mutates, and it's beginning to mutate. Yeah. So this is a critical moment.
I think that's so important these next 3 months. And just to restate, just as like 2 or 3 weeks ago, British leaders said they would never go on another lockdown, and now you guys are in just as full of a lockdown as you were back in April, correct?
Correct.
Yeah. Catherine?
With patients in hospital up 50% from the peak in April.
Yeah, and the 7-day average continues to move upwards.
Yeah.
Catherine, guidance, counsel, advice for Americans watching this?
Well, I think that one thing that's very American is a desire to plan. At least I'm that way. And it's been one of my biggest challenges in Italy, where people don't plan nearly as much. They live in the moment. So I think the real challenge is living in the moment, because we need to live day by day, because we really don't know what's coming. But at the same time, to really see the light at the end of the tunnel, because it's there. And as Ross pointed out, the media often fear sells, fear always sells. And so just like my friends in Italy who see the pictures of the Capitol and say, this is what America is right now. And you say, no, it's really not. That's an extremist. That's something that's a very specific terrorist extremist group. That is not America right now. And in the same way, we need to look at all the positive that is happening and this unbelievable miracle of the vaccine. So let's all try not to be those people that you read about that, made it through the entire Second World War, and then in the middle of 1945, something happened. So, we're almost there. So live day by day, but with real optimism and keeping hope and seeing the light at the end of the tunnel.
Yeah, thank you for that, Catherine. Mohamed, what counsel would you give Americans watching this?
I would say continue all the things that we've been practicing. I'm bicultural, and on the American side, people in the US don't tend to shake hands as much as Africans do. People shake hands, they hug. As the same way, maybe Catherine can tell us how Europeans kiss each other and all the time, right? So here, a lot of shaking hands, a lot of hugging. Social distancing has been very helpful. We have done away with the handshakes. People still do, but more and more people will greet you from distance or touch you with an elbow. That sort of thing really helps. A lot of frequent hand washing really helps. At the government level, I think if this second wave comes, the government is prepared to have a hard lockdown of all international movements, and I think that could give us some space to deal with things here internally.
Yeah. Mohamed ABDIRIZAK, the foreign minister of the government of Somalia, Ross CIESLA, the chief investment officer at Veritas Investment Partners, and Catherine Wilson, author and culture commentator. Catherine, tell us again the name of your book that they can find on Amazon.
The book is The Mother-in-Law Cure.
Great.
They can find it on Amazon.
Good. For those that don't know, I went to graduate school with these three, and they're all great friends. Thank you guys. I love you. Stay healthy. Appreciate you doing this.